All right, guys. Hey, what's up? It's Jeff Winchester again with the Louisiana Knights. And joining us today is Dr. Jason Rolling, Covington Orthopedics. And Dr. Rolling's been on here a couple different times talking about a few other topics. We have a good video on scapular mobility that you can find on the Knights YouTube channel, okay, Louisiana Knights. If you haven't seen that one, you may want to check it out. It's really, really good. It gives you some good anatomy tips and also talks to you about the importance of scapular mobility in the throw. Tonight, very big topic, and we were excited to be able to have Dr. Rolling come in here and talk about Tommy John, what it is, really the numbers behind what's been happening as far as our game at the lower levels with the youth players and even at the higher levels with the big league guys. And it's really important that we have this discussion tonight so that we can get a better understanding about this injury that's been plaguing our game and how we can go about potentially maybe avoiding it in certain areas, in certain ways, but also some red flags that may very well be indicators of what could happen in regards to potential injury if we don't address certain issues. So with that being said, I know we may have some guys coming on, logging in throughout the course of the talk tonight. Feel free to ask any questions. If you're watching the rebroadcast of this, leave comments behind. We go back and we check the comments and we address them. We can go to our Facebook page and we'll from time to time go back and address some of the comments left behind on some of our previous videos. So without any further ado, Dr. Rolling, take us through Tommy John.
Thanks, Jeff. So yeah, again, today we're going to talk about Tommy John surgery. It's obviously fairly well known in baseball circles. Even lay people generally know, and I've heard of the term Tommy John surgery. Most people kind of know that it's involving the elbow, but it's gained a lot of notoriety over the last sort of 10 to 15 years, and it's basically related to the degree that we see this injury a lot more. So we're going to talk about it, what the surgery is, some ways to prevent it, and some of the things that are a little more applicable to baseball coaches, players, parents, etc. Tommy John. Tommy John is the baseball pitcher here, seen right here where my arrow is, and he was a baseball player for the Dodgers. And this guy right here is Dr. Frank Jobe, and he is the man that pioneered the reconstruction of what is called the ulnar collateral ligament of the elbow. He did it in 1974, and Tommy John did not pitch again until 1976, but he had an incredibly long career, and he played until 1989, part of which he credited Dr. Jobe, who's seen here, who unfortunately recently passed, with extending his career by doing this surgery. He also credits, just a note, his strength and conditioning coaches and coming up with a program that really kept his core strength and his leg strength where it needed to be. And he really had a very rigorous off-season program that allowed him to play. At one point, I believe when he retired, he was had the most years in Major League Baseball until Nolan Ryan passed him up. So just interesting note. And so the Tommy John surgery, and this is actually a picture from the actual study and publication that Dr. Frank Jobe put in. And it's kind of difficult to see, but basically he did a figure eight sort of remaking of a ligament that goes on the inside of your elbow. And so the area we're talking about is right here. Just for those of you to see, this is the inside part of my elbow. that little bone there, we're going to talk about what that is. That's called the medial epicondyle, as opposed to the outside part here. And just to let you know, this outside part is the part that gets inflamed when you get tennis elbow. And so this is the actual picture that he put in. And he didn't publish it till about 10 years later, interestingly enough. So the anatomy, we kind of talked about. I showed you my elbow. There are several structures here that we kind of care about. Some of them are on the medial side. That's the inside, and that's this bone right here called the medial epicondyle. The ligament itself, you'll see, attaches from this medial epicondyle and goes to this area on the bone called the ulna. There's a little bump here called the sublime tubercle. And no, it is not named after the band. But the outside part, or the lateral side here, it does make a difference too. And you'll see how there's this bone here called the radial head. There is this bone here called the capitellum. And if you'll notice, they look a little different because they're mainly cartilaginous. And we'll talk a little bit later. When this ligament goes, it can put excessive stress on this area of the elbow, as well as in the back where the olecranon articulates. So, and I don't have a good picture here, but I think everybody can realize this bone articulates with the backside. And we're talking about that bump right there. And that can get inflamed and have issues when the restraints for the elbow are sort of lost. For the most part, the elbow is basically a hinge joint. If you took my hand here like this, it sits in it like this. But it still needs constraints to hold it right. If you remember right when we talked about the shoulder